Auckland medical clinics are running out of measles vaccines as they scramble to keep up with ballooning demand for immunisations. The number of measles cases in the country's worst outbreak in more than 2 decades has now topped 990, with 821 of those in Auckland. This time last year, there were 12,000 doses of MMR distributed nationally over a month. There were 9,000 distributed yesterday alone. Auckland health authorities say they have plenty of MMR doses available, but medical clinics say they are giving so many jabs they're running out and patients are being told they'll have to wait a few days to get them. Reporter Nita Blake-Persen and cameraman Nick Monro visited Titirangi Medical Centre in West Auckland today, where staff were rushed off their feet answering patients' questions around immunisations and administering jabs. Dr Michelle Conning told them medical clinics across Auckland are in a similar position and people will just have to be patient.
I mean, my understanding is there's no shortage of vaccine, but because of the overwhelming demand for it, particularly this week, it's just a logistical thing of getting the vaccines ordered and here. And because that process, obviously, the vaccines need to be sent out at a certain temperature, and this is happening probably all across Auckland. So I think that everybody that wants one is going to be able to get one, but it just can't happen right now, right this minute, because there just aren't enough, there isn't enough room in the fridge or enough nurses to do the number of people wanting it right this minute.
So have you experienced delays here?
So I think it may be that there's a delay of a couple of days, which is just a logistical thing, just getting the vaccines here. It's not that we can't get them, it's just they have to come from somewhere else. And only a certain number can be stored at a time and given in a day, because there's a limited number of bodies on the ground really to do it.
So you've seen firsthand the impacts of measles.
When my eldest son was 14 months old, we had been on holiday overseas and we'd come back and a couple of days home, and he became really ill quite quickly with a really high fever, and it got quickly worse, so and couldn't get the fever down. He wouldn't eat and drink, was sleeping all the time, so we ended up being admitted to Starship, and they didn't know what was wrong with him. His face became so swollen that he couldn't open his eyes, and had to be on a drip for several days because he wouldn't drink anything. So it wasn't until when he was starting to get better that someone said, oh, maybe this could be measles. And I think it wasn't until after we got home that the test had come back saying that it was. So it was pretty awful. So he was 14 months, so he was 1 month younger than the recommended immunisation time. And so looking back, obviously wish that I had have got him immunised before we went away, and then he wouldn't have got sick.
And so over the past few days and months, what has been your experience with the measles outbreak in your clinic and your community?
So I think there's been lots and lots of questions, particularly in the last few days. I think almost everybody has a question to ask that we may be seeing about unrelated things. And certainly the clinic's been completely overwhelmed with people wanting to come in and have vaccinations or ask questions about vaccinations, which is great, but it's, pretty overwhelming. Everybody's exhausted,
Are these people who are scrambling now because maybe in the past they weren't interested or had different views on vaccinations?
I think we are seeing a group of people that are changing their minds and deciding to immunise where they hadn't before, and then we've also got the older age group that are being advised to come in and have boosters if they don't know about their vaccination history. Most people are pro-vaccination and come in and have their vaccines, and then we do have a group who are anti-vaccination, and then we do have a group that have been undecided, and I guess because we haven't had an active threat, they have delayed their decision, and then something like this happens, and thankfully it provokes them to come in and protect themselves and protect their children.
Do you have a message to people maybe who are still peddling these myths, really, when it comes to vaccines?
You know, we have patients who sit in our waiting rooms who are very vulnerable. We have patients who've had organ transplants. We have children who have had chemotherapy recently. And we have young adults who've had chemotherapy recently for cancers that come in because they have to see us for other reasons, and they're actually scared sitting in our waiting room waiting for something to happen. And you know, I hear the message out there is that the herd immunity is not a good enough reason to vaccinate children, but I guess what I would say is that if I was a parent of a child that couldn't be vaccinated, I would be absolutely terrified at the moment. And I think that people who don't believe in immunisation, if they had a child in that position, they would most likely feel differently, because these kids and young people are basically hiding away, scared to go to school or university, because we just don't know who might be infectious.
And that was Dr. Michelle Conning speaking to our reporter Nita Blake-Persen, and that interview will go up on our Facebook page and online if you want to watch it back.